Hi, I'm Dr. Joe Robertson, and I wanted to speak to you a minute about an exciting new option that we have at the California Ear Institute. As you know, our specialty is congenital oral atresia and microtia, and our cultural heritage has been to find a better way. For about 20 years now, we've been focused on this condition and really mostly on the hearing and ear canal components. And we have had a long history of innovation where we provide solutions to problems that have been faced around the world. That's one of the reasons that we believe that our surgical results are among, if not the best in the world. And in those years, we have come up with a number of things for the ear canal. For example, we were the first ones to perform the ear canal or atresia repair before the outer ear repair. We also were the first place to do combined atresia microtia repair, ear canal and outer ear in the same situations. I created a mapping or grading system that goes by the acronym HEAR MAPS that allows us to thoroughly investigate each person and then to correlate preoperative data with postoperative results. Very important for knowing when to say yes to surgery and when not to say yes. We also are the first to perform micro-invasive atresia surgery, tiny little incision that we have pioneered. We have discovered in the middle ear one of the problems that had been previously unrecognized between the second and third middle ear bones, the joint, the incudostapedial joint. 32% of patients have an abnormality there. And we have then come up with prostheses to fix that problem. So in a third of patients, that massively improves their hearing situations. We've also been the first to use a split thickness skin graft from the scalp, which is the best in terms of healing and the quality for the ear canal. We also have figured out a way to secure the porous polyethylene implant when we do a combined surgery, because we noticed that when we do separate surgeries, frequently the ear moves down and sometimes can even block the ear canal. And then lastly, what I want to talk to you today is about something called the Robertson Camp prosthesis. Now, the history of this started when I asked one of the surgeons who we worked with for quite a while what the complication rate was with this implant. He replied to me that he had no idea, and that bothered me. I had been hearing from a number of patients problems, like you see on this slide, that the implant was causing fractures. And you can see in each of these 6 photographs where patients had a fracture. Sometimes it's due to trauma, but sometimes it seems to just come by itself. So the implant that we've been using, Matrix Surgical or Omnipore implant, I look back over that two-year period, as I said, and we have a significant issue. So what do we do about that? Well, I think the problem is best addressed by designing a new implant. So that I've spent a period of time in office with a drill and with different types of prostheses and created a prosthesis that I think is way more resistant to fracture, that is more natural appearing, and that allows an ear canal. This is the first prosthesis like this that allows that. And we're working with a company that also allows us to do customized implants, to do 3D scanning, and to match the opposite ear. You can see here 3 examples that I've created actually in the lab that we then worked to a prototype. So that implant or that company is called Poriferous, and we now have the Robertson Combined Atresia Microtia Prosthesis, or the Robertson Camp prosthesis. It's a single piece. They're left and right, multiple sides. They're much more stronger and slightly flexible compared to our previous, and I believe they'll provide better cosmetic design. They'll have better projection, which means the ear will stay out from the head more easily and will be very stable. So I'm happy to announce to you that we now have a release impending in December of this prosthesis, and that will be a standard procedure for the patients that come here to us. I'm excited to use the implant. It's a material and a company that's had hundreds of these implanted over the years, so we think that it will be very predictable. We think it will produce good results, and I'm excited to see it work.